Hello, I'm Mark Melotik from Kenosha County Division of Health. I'm the Environmental Health Manager there. Welcome back for another week of questions from the COVID-19 FAQs. We're here today from the Kenosha County Joint Information Center, and you can submit your questions for future videos at covid19@kenoshacounty.org. Here's this week's questions and answers. How many people in Kenosha County have been tested? That tells the real story. The number is based on the negative tests cases and positive cases tested to date. It's around 1,800 people tested in Kenosha County to date and equals about 1% of the population. I was wondering what kind of primary limiting factors that are preventing more widespread testing of people in Kenosha County. Collection kits have been a limiting factor up to this point. We are at a turning point where we believe that more testing will occur in the coming weeks. Kenosha County has both traditional and new channels for testing. Another limiting factor were the testing tiers that limited the testing to any of those who were most severe symptomatic. Now guidance in this past week recommends that testing anyone or even with mild symptoms can be tested. Our third question is not as much a question as it is a statement. I would love for the people to understand that just because you test negative for the coronavirus one day, that does not mean that you're immune to catching it another day. It seems like people do not understand that only at the moment you are tested that you are not positive. So this is coming from people to keep in mind, just because you have tested negative on one day does not mean that you are not susceptible in contracting the virus at any time in the future. If they were in close contact with somebody who tested positive, they could still come positive within the next 14 days, post-exposure window. Those who have been tested should always take care of the same precautions as the general public. So the test is only good at a certain time when you're just tested. Question number 4. How many positive tests in Kenosha where people were still working at the time of their diagnosis? This is to discuss contract tracing. Out of the 314 cases in Kenosha County, 5% indicated that they were unemployed, and 6% indicated they were retired. We track the positive cases who are employed. We reach out to any close contact who was near the positive case and provide them with education and information for what to do if they are sick or they get sick. They are also asked to stay home, quarantine and monitor their symptoms for a 2-week period based on the last time they came into contact with a positive person. We collect some information such as if they have any underlying medical issues, other health issues, and we take all those into account. Number 5 is, what are the percentages by age of the positive test? This information is updated daily on the Kenosha County COVID-19 Response Hub, the website, but the highest percentage of positives currently are in the age range of 50 to 59. My range. So, what number of people who passed away in Kenosha County were treated with hydroxychloroquine or azithromycin? According to the CDC, no specific treatment for COVID-19 is currently FDA approved. Specific patient treatment is confidential information, so we actually don't have that information at this time. What is current number of COVID cases being cared in Kenosha hospitals? As of 11 o'clock Friday, April 24th, we have 16 patients in Kenosha hospitals, Aurora Kenosha Medical Center and both Frederick South locations. Is Kenosha going to enforce the extension of the state's Safer at Home order or fall in line with Racine County and others that said they will not? Law enforcement within Kenosha County have been and will continue to follow guidelines established in the order. I can go online to see a number of cases per day in Kenosha County. I see the dashboard, which shows the current cases of yesterday, but I'm looking for a daily number so I can see the curve. We will be releasing Kenosha County's projection model in a press release this weekend. We will add this curve to the Kenosha County Hub on Monday and will update this curve as the data is entered changes daily. We will not at the peak of the curve for Kenosha County, but yet Kenosha shows that the Safer at Home is indeed working to help flatten the curve in Kenosha County. Thank you, everyone, for following through with this order that helps all of us. Have any new reports of COVID-19 cases confirmed since April 7th been linked to election-related activities through contact tracing? If so, how many voters and how many poll workers? If not, is this a link health investigators are looking for? Does the county expect to see new COVID-19 cases linked to Election Day and in-person voting? We have identified 2 COVID-19 positive Kenosha County residents who did vote in person on Election Day. This only proves a correlation but does not prove causation. We cannot definitely state that they got COVID-19 as a result of voting in person. I'd like to thank you for joining us this week. Please send your questions to COVID-19, kenoshacounty.org, for consideration future videos. If you have any questions for COVID-19 that needs to be immediately answered, please call 211. Thank you.